Exosomes for hair loss, the truth behind the hype. Exosomes are being called the fountain of youth for hair loss, with celebrities and influencers claiming they regrew a full head of hair in months. But here's what they're not telling you. Most exosome treatments are unregulated, wildly overpriced, and some are complete scams. So what's the real truth? I'm Dr. Mara Weinstein. I'm a board-certified dermatologist, and my last video on exosomes went viral because I told you the truth that no one else would. Today, we're diving deeper into exosomes specifically for hair loss and what they actually are, how they really work, and why the $3,000 treatment at your med spa is pushing might be a waste of money. I'm also going to tell you about the one type of exosome that's actually showing real results and why most providers won't use it. So what are exosomes really? Before we talk about exosomes, we need to understand what they actually are, because there's massive confusion and misinformation out there. Exosomes 101. Think of exosomes as tiny little messenger bags that cells use to communicate with each other. They're about 1/1000th the size of a human hair and carry cargo, growth factors, proteins, and genetic material. The hair loss connection. So hair follicles need constant communication to stay healthy. As we age, this communication tends to break down, and exosomes can potentially restore these signals. They carry growth factors and fibroblasts and other signals that help to stimulate hair follicles to grow hair. Now, I had a patient, Jennifer, a 45-year-old woman who had been losing hair for 3 years after a stressful divorce. Traditional treatments weren't working. She tried many things over the counter, and after 4 sessions of properly sourced exosome treatments, her hair density increased by about 60%. But here's the key. We used age 0 mesenchymal stem cell derived exosomes, not the cheap alternatives that most places use. The critical difference most people don't know is that not all exosomes are created equal. The source matters. It's everything. They're plant-derived exosomes, which tend to be the cheapest option. They're about $200 to $500 per treatment, but there's limited research on the effectiveness, and they may not communicate properly with human cells. They're often used by budget med spas. There are platelet-derived exosomes, which have a mid-range price from about $800 to $1,500 per treatment. There's definitely some promising research on these exosomes, but the quality varies wildly between providers and the sourcing can be questionable. Now, age 0 mesenchymal stem cell derived exosomes are the most expensive, so they can be between $2,000 and $4,000 per treatment. The sourcing problem. Now, this is where it gets scary. Many providers don't even know where their exosomes come from. Were the donors screened for diseases? How were the exosomes processed and stored? What's the actual concentration of the active ingredient? And are they even real exosomes or some just expensive saline? Now, after researching dozens of companies, I found that Resilier has the most rigorous testing and quality control. Their age 0 mesenchymal stem cell derived exosomes have shown the most consistent results in my practice. This is crucial because exosomes aren't magic. They only work for specific types of hair loss, and timing is everything. So who's the perfect candidate? Those with androgenetic alopecia, which is patterned hair loss or inherited hair loss, like men with thinning crowns and receding hairlines, and women with diffuse thinning on the top of their scalp. In this condition, hair follicles are miniaturized but not completely dead, and there's no scarring. The results are best when it's caught early on. Now, David, a patient of mine who is 35, noticed his hairline receding and crown thinning. Instead of waiting until he was bald, he started exosome treatments immediately. After 6 months, his hair density increased by 45%, and the progression of his hair loss stopped completely. Now, exosomes as a standalone treatment can be very helpful, but in this case, especially with men and androgenetic alopecia, there can be some other supplemental prescription treatments that are effective along with exosome therapy. Another type of hair loss is telogen effluvium. This is hair loss that occurs after surgery, illness, major stress, or nutritional deficiencies and rapid weight loss. In this case, it usually occurs 3 to 6 months after the triggering event. hair follicles are shocked but not damaged. And in fact, they're kickstarted into the shedding phase, so you notice more shedding over a shorter period of time than you would in the normal hair growth cycle. So exosomes can help restart that hair growth cycle and renormalize it. In post-pregnancy hair loss, hormonal changes cause widespread shedding, which is usually temporary, but it can be prolonged. Exosomes can accelerate the recovery of hair post-pregnancy. It's safe for breastfeeding mothers, but for this condition specifically, exosomes are most effective when combined with other treatments specifically to treat alopecia areata. Poor candidates for exosome treatment include patients with advanced male pattern baldness, so if you're completely bald on top, exosomes won't help much there. If there are dead follicles that can't be revived or any scarring on the scalp, hair transplant might be a better option. It's not worth it to waste money on false hope. With scarring alopecia, there are conditions like lichen planopilaris or frontal fibrosing alopecia, where the hair follicles are permanently destroyed. Scar tissue can't grow hair, so exosomes won't be helpful here. The focus should be on stopping the progression, which your board-certified dermatologist can help you with. Psychological treatment and intervention is most important here first, and then exosomes can help later on with that regrowth of hair. The timing factor. So early intervention is everything with hair loss. Miniaturized follicles can be revived, but dead follicles cannot. Let me walk you through exactly what happens during the exosome treatments, because knowing what to expect helps you evaluate if your provider is doing it right. Now, before your treatment, you have to have a proper consultation, which would take about 35 to 45 minutes. In this consultation, we take a detailed hair loss history and family history. We do a scalp examination, sometimes using something called dermoscopy. And we also take initial baseline photos for tracking progress. And of course, it's important to discuss a realistic expectation and our timeline. If you're in a consultation and the provider promises some specific results or pushes you to buy packages immediately. I hate packages. And they can't tell you the source of their exosomes, or they claim 100% success rate, I would run. There are some pre-treatment preparation tips to keep in mind. So stop your blood thinners about 48 hours before if it's medically safe. If you're on a blood thinner that is supposed to be to help prevent clots, or you've had a stroke or any cardiac conditions, make sure that you don't stop those. You don't need to stop those if they're prescribed with exosome treatment. Right before the treatment, make sure you come in with a clean scalp and don't apply any products like hairspray, mousse, or gel. Avoid any alcohol consumption about 24 hours before, and make sure to get good sleep and stay hydrated. During the treatment, we first prep the scalp, which takes about 10 minutes. The scalp is cleaned with an antiseptic solution, and then we section the hair to expose the treatment areas. Numbing cream here is optional, but we don't usually use it. It's not recommended. It can actually falsely hydrate the scalp. And if you're super sensitive, we can definitely use it. The second step in our case is preparing for microneedling. The scalp is microneedled to create these little channels, which allows the exosomes to penetrate a little bit deeper. It also helps to increase blood flow to the follicles. Some providers will skip this step and use other methods to help drive the exosomes into the follicle. More and more methods are being studied, and so microneedling is not the only way to do the procedure. Step 3, exosome applications. Exosomes are applied directly to the scalp, and we gently massage them into the sectioned hair to ensure an adequate distribution. Some providers use injection techniques and others apply topically. As far as we know, injection is not the safest or approved technique, but it can be more effective. Red light therapy can be used to enhance absorption. This is something that can be done at home with red light scalp caps. We know that these caps stimulate cellular activity and reduce inflammation, but not all providers offer this in the office. You can buy red light caps at home as well. So my patient Sarah, she described her exosome treatment as slightly uncomfortable but not painful, and the microneedling felt like light scratching. She was able to return to work the same day with just a little scalp redness that was undetectable. Immediately after treatment, the scalp might be a little red and slightly tender. Some pinpoint bleeding is normal, but it will stop before you leave the office. What not to do after treatment: don't wash your hair for 24 hours. Avoid saunas, steam rooms, and hot yoga. Don't swim in any pools or the ocean, and don't use harsh hair products or any harsh hair dyes for about a week. Let's talk about results. This is where most people get disappointed because they have completely unrealistic expectations about how hair growth works. The hair growth reality check. Hair grows in cycles and you can't speed up biology. Hair grows about a half an inch per month and it takes 3 to 4 months to see new hair growth. Full results might take about 6 to 9 months. And it's so important to be patient during the process. Now let's look at the month-by-month timeline. Month 1 is called the shedding phase. So you might actually lose more hair initially, which is totally normal and expected. The weaker hairs are being pushed out, but don't panic. This is actually a good sign because we need to make way for new hairs to grow. In months 2 to 3, the hair loss should slow down, but you're not going to see a lot of visible new growth yet. The follicles are waking up internally, and this is actually when most people give up, but don't. By month 4, we'll start seeing the first signs of success. Find baby hairs that start appearing on the scalp. Existing hair might look a little bit thicker, and the scalp might look less visible or less scalp show. One pro tip is to take progress photos at home to track your changes. By month 6, we usually appreciate significant improvement. The new hairs are longer and thicker, the overall density is noticeably improved, and this is when patients start to get excited. This is when we encourage patients to continue treatments for best results. Over months 9 through 12, we see those maximum results and the full benefit of treatment is visible. We notice hair looks significantly thicker and we see confidence levels dramatically improve in the office among our patients. So at this point, we talk about a maintenance plan. I had a patient, Michael, who had 4 exosome treatments over 6 months. His before and after photos showed a 65% increase in hair density. His hairline moved forward by 1 whole centimeter, and he gained about 70% more coverage in his crown. He went from wearing hats daily to feeling confident without them. In general, results can be variable, but we've noticed about a 40 to 70% increase in hair density, which is a pretty realistic range. Existing hair becomes thicker and stronger, and there's new hair growth in thinning areas. We also notice that there's slowed or stopped progression of hair loss. This is when it's so important to be realistic about expectations because results might not look like this. So complete restoration of your juvenile hairline, going from bald to a full head of hair, overnight transformation, or 100% coverage in completely bald areas. Those are just not realistic expectations. The reality of it all is that we need maintenance. The maintenance reality, we're looking at an initial series of about 4 to 6 treatments spaced monthly, and then maintaining with about 2 to 3 treatments per year. The results gradually fade without maintenance, as you might imagine, so it does take an ongoing investment to have sustained results. Exosomes work best as part of a comprehensive hair loss strategy, not as a standalone miracle cure. Remember, your hair loss is a journey. It's unique, and the right treatment for you might not be the most expensive or trendy option. Sometimes the best choice is the one that fits your budget, lifestyle, and realistic expectations.